So, Michael, one of the things that a lot of people don't really understand is how does cancer actually grow and really, evolve in the body? Can you kind of explain really how cancer gets started?
Sure. So cancer, in order for one of our normal cells to become a cancer cell and then to form a tumor, mutations have to occur. And those mutations come from a variety of sources. They come from UV radiation from the sun. That's why we put sunscreen on. They come from chemicals in our environment. They come from cigarette smoke. And they also arise just kind of spontaneously. There's a very slow, spontaneous rate of mutations occurring in our genes, in the cells. And that's why cancer is a disease of aging, or predominantly a disease of older people. It's because in order for, in particular, a solid tumor to form in one of our organs, breast or lung or colon, a single cell has to accumulate between 10 and 15 independent mutations. And that typically, because those mutations are occurring from many different reasons, different sources, it typically takes 10, 20, even 30 or 40 years before a cell has accumulated those 10 or 15 mutations and then can become a tumor cell. And that's why cancer, by and large, at least most of the solid tumors, are diseases of older people, of aging. Now, the reason why it's been so difficult to cure advanced cancers is that I've said that it's really 10 or 15 mutations. But in fact, we now know that there are over 200 mutations that contribute to cancer. And so each tumor is actually a different combination of 10 or 15 out of those 200 or 300 mutations. And there's a lot of redundancy. So if you target one of those mutations, another one might just be able to take its place or to overcome the defect. And so that's really one of the main reasons why it's so difficult to treat advanced cancers. And it's also really one of the reasons why we invented and are carrying forward Decoy, which is that, as I mentioned, if you just target one mutation or one pathway, it's very likely that one of the other mutations will take over, and that maybe you'll get an effect for a little bit, but then the tumor will become resistant to one particular treatment. And this is not only true for therapies that target the tumor cells directly, but it's also true for therapies that target just one target or one pathway or one cell type in the immune system. And to me, the real beauty of the Decoy platform approach is that we have a delivery package. That's really what the bacteria are. They're a delivery package, but they're a delivery package that contains maybe a dozen or so different immune-stimulating agents that can, as we've mentioned, can hit both the innate pathway and the adaptive pathway, and that gives us the best chance to overcome the fact that the tumors have many different mutations that help them to escape.
Now, going back to just a little bit earlier in the process, not the advanced tumors, but the process of these mutations happening, doesn't the body most of the time capture these cells and kill them and get rid of them?
We think so. So there is a significant amount of evidence suggesting that as a cell accumulates these mutations, we have what we would call precancerous or benign. In some cases, it's benign. In some cases, it's a precancerous lesion. Either one can eventually lead to a malignant phenotype, a malignant tumor. And an example of that might be polyps, in the intestine. And there's evidence that our immune systems are able to recognize many, if not most, of those precancerous cells and eliminate them. And that's because those cells haven't yet accumulated enough mutations to allow them to really hide effectively from the immune system by, say, secreting something that kind of blocks the immune system from seeing the tumor. And so it's really only the minority, we think, that get through finally after years and years and years of accumulating enough mutations, become an advanced tumor and then metastasize. And of course, most people who die from cancer die because they already have metastatic disease. That is, it's already spread in the body at the time of the diagnosis. That's the most difficult setting to treat. And that's really what we're going after.
Now, one of the things I've heard you talk about in the past is how cancers can remodel the immune system, systemic immune system, and that the Decoy platform helps the immune system essentially reset itself or counteract that. Can you explain how that works?
Sure. So there's evidence now from a number of published studies indicating that in order to treat an advanced tumor, we have to mobilize, a systemic immune response, and that really makes sense. And it makes sense because most of the steps of mobilizing and activating the immune system don't take place in or near the tumor. Many of the immune cells come from our bone marrow. Many of them have to go to various places to mature. And in fact, the main recognition step that occurs of some part of a tumor, what we call a tumor antigen, being recognized by an immune cell, that actually takes place in lymph nodes. So, in fact, most of the steps of mobilization, activation of the immune system take place outside the tumor. And there's also, as you pointed out, there's also evidence that tumors can secrete factors that go throughout the whole system and dampen or remodel the immune system. And so that's why we've designed the Decoy bacteria to be able to be given intravenously, to be given systemically. We think this is going to give us a much more powerful response than trying to put something directly in the tumor or to just target the tumor. And in particular, we know the Decoy bacteria will be processed by the liver and the spleen. These are considered major immune or lymphoid organs, and they contain a lot of immune cells that can become activated and could potentially contribute to the anti-tumor activity, particularly if we're treating a tumor that's in the liver, say a liver cancer or the very deadly cancers where colorectal or pancreatic cancer have metastasized and spread to the liver, which really are the ones that today we have so much trouble curing.
Well, this is great. Well, thank you very much, and congratulations on a great week.
Thank you.